How can latent TB not be contagious? Imagine carrying a silent passenger inside your body that's not causing any trouble. That's what happens with latent tuberculosis infection. The bacteria responsible, called Mycobacterium tuberculosis, are present but stay inactive, meaning they don't multiply or cause symptoms. Because they're not actively growing or being expelled, a person with latent TB cannot spread the bacteria to others. In latent TB, the immune system does a good job of keeping the bacteria in check. It surrounds and contains them, preventing any growth or tissue damage. The bacteria remains dormant, often in the lungs but without causing any illness or cough. Since coughing is the main way TB spreads, by releasing tiny droplets into the air, no cough means no transmission. People with latent TB usually feel perfectly healthy. They have no symptoms like fever, weight loss, or cough. Without a cough or any other signs of active disease, there's no way for bacteria to escape into the environment. This is why latent TB isn't contagious. It's only when the bacteria become active again, often due to a weakened immune system, that the person can start to spread TB to others. Doctors diagnose latent TB through skin or blood tests, which show if the immune system has responded to the bacteria. Chest X-rays help rule out active disease. Since latent TB isn't infectious, treatment focuses on preventing it from becoming active later. This helps protect the individual and the community. From a public health view, people with latent TB do not pose a risk of spreading the infection. But they are at risk of developing active TB if their immune system weakens, which is why treatment is important. It's a way to keep the bacteria dormant and prevent future transmission. So, to sum up, latent TB isn't contagious because the bacteria are inactive and contained within the body. Without symptoms or bacterial shedding, there's no way for the infection to spread. Only when it reactivates into active TB does the person become infectious. Always remember, if you think you might have TB or have been exposed, consult a healthcare professional for proper testing and advice.